Good morning, sir. I am Nicole Macalisang, your pharmacist for today. How may I help you?
Good morning. I have here my prescription. Can you please check it for me?
Sure, sir. Okay, so you have metformin oral tab 500 milligrams, sir. Please give me a minute. I'll just check if your medication is available.
Sure.
Hello, sir. I've checked your medication and it is available. But I'll ask you some questions first. Is that okay, sir?
Yes, that's fine. I also have concerns too.
Oh, you do, sir? You can actually tell it to me now.
Well, you see, I'm suffering from type 2 diabetes for 2 months now. But lately, my blood sugar became too low even though I'm taking my medication. I don't know why this is happening, but it is really bothering me. Can you give me some advice for that?
Of course, sir. It's actually good that you are paying close attention to your blood sugar. And if that's the case, I am going to further ask you some questions. Is that okay, sir?
Yes, sure.
So how long have you been suffering from low blood sugar, sir?
I think only a few weeks ago.
Oh, I see. How about your food, sir? May I know what have you been eating lately?
I can exactly remember, but I'm sure that my diet is on the healthy side. I have also been following all my doctor's advice since my last consultation.
Okay, sir. Is there anything else that you're taking aside from your diabetic medications?
Well, I'm taking some herbal medicine now. It's called ginseng.
Oh, right. Since when did you start taking ginseng, sir?
I guess for about 3 weeks now.
Well, I think I can see the problem now, sir. Let me discuss it with you one by one. Is that okay?
Yes, of course.
Okay, before we start, sir, let me verify your patient information first. Can I ask for your name, age, and address?
I am Adrian, 45 years old, and from Taguig City.
Okay, great. Now, let's go over to your medication. So, you have been taking metformin for 2 months now. And I guess you have an idea with this medication. But just to refresh you a bit, you use metformin to lower your blood sugar. You can use it alone or you can combine it with other oral anti-diabetic medications or with insulin. And you have to take metformin tab by mouth. The usual starting dose is 500 milligrams twice a day or thrice a day. You have to gradually increase the dose by 500 milligrams every week depending on your response. But it should not exceed to 3,000 milligrams daily. The maximum dose is 3,000 milligrams, but you have to divide it into 3 doses per day. And it should be taken with a meal. Are you taking it with a meal, sir?
Yes.
Okay, good. Aside from that, you have to store it at room temperature and you have to keep it away from sunlight and moisture. You may also experience some adverse reactions, sir, and you have to take note of this carefully. You may experience headache, diarrhea, nausea and vomiting, decreased appetite, and insomnia. This is common, sir, okay? But in cases of severe adverse reactions like vitamin B12 deficiency, chest pain, asthenia, or physical weakness, you have to consult your doctor. If you are taking alcohol while you are using this medication, you should limit your alcohol intake because it can cause lactic acidosis and it can lower your blood sugar.
Okay, I'll take note of that.
Now let's go to your concern, sir, okay? Ginseng should not be used if you are taking diabetic medications like metformin. It is a complicated process, but don't worry, I am going to make it simple for you. Basically, ginseng and metformin can have herb-drug interaction. Ginseng can cause hypoglycemia or lower blood sugar, and it could interfere with the effectiveness of metformin. Herbal medicines like ginseng can trigger side effects and interact with other herbs, supplements, and medications. That's why it's important that you should talk to your doctor or a pharmacist first before taking ginseng.
Oh, I see. I wasn't aware of that. I was just actually looking for other complementary alternative medicine treatments, so I decided to use this herb.
It's okay to explore other camp treatments, sir, but you have to be careful next time.
Okay, I will remember that.
Ginseng is actually good for the immune system because it fights stress and diseases. But in your case, sir, I recommend that you use other herb treatments that will not interfere with your medication.
Okay, I will surely do that next time.
So before we end our discussion, can I ask you to repeat the information that I've told you, sir, to see if you understand it?
Yeah, sure. I have to take metformin tab orally and I should take it with a meal twice or thrice a day. The starting dose is 500 milligrams and I have to increase it 500 milligrams every week. The maximum dose is 3000 milligram and I have to divide it into 3 doses daily. I have to store it in a room temperature away from light and moisture. It is also common to experience adverse effects, but I should consult a doctor in case of adverse effects like lower blood sugar, chest pain, and physical weaknesses. What else? Oh, I should be also careful in using herbal medicines like ginseng because it can trigger side effects and cause interaction with my medication.
Okay, sir, we are good. Do you have other questions?
None so far.
Okay, sir, thank you for your time. Just remember that if you have other questions or concerns, don't hesitate to call or come over here again. Have a great day.
Sure, I will do that. Thank you. Bye.